Good morning and welcome to your Farm and Home Show. I'm Kristi Shive, and this morning we're visiting with Elizabeth Westbrook. She's a cancer control specialist for the Kentucky Cancer Program. Good morning, Elizabeth.
Good morning, Kristi. Thank you for having me.
I'm so glad you're here, Elizabeth. And today you are going to remind individuals of the importance of breast and cervical cancer screenings. But first, Elizabeth, can you tell us what is the Kentucky Women's Cancer Screening Program?
Well, the Kentucky Women's Cancer Screening Program has been around for a long time. It's actually funded through the Centers for Disease Control and Prevention. And it's a program to help women who don't have insurance get mammograms and pap tests and other services.
Now, Elizabeth, this is a very good time to be talking about this because we have come out of a year that many people have skipped doctor's appointments and screenings. And so it's really important for people to be getting those screenings. Now, Elizabeth, what age should women begin breast cancer screenings?
Well, typically we think that mammograms should start between the ages of 40 to 44. You would start with a baseline mammogram. And then mammogram screenings should be done yearly from 45 to 55. And then at 55, women have the option of doing it every year or every other year. It's really important that women work with their providers to find out, because depending on the woman's individual family history, she may be at higher risk. And so therefore she might have to even start screenings earlier, or may choose to have them more often than someone else who's at lower risk.
It's definitely something that they want to talk to their provider and see if they are below that higher age range, that it might be necessary for them to go on and get those screenings.
Right.
What about cervical cancer screenings, Elizabeth?
Well, cervical cancer screenings are also very important. And typically we think of cervical cancer screenings as pap smears or pap test, and most people are familiar with that. They've also incorporated HPV testing with that, because we know that the human papillomavirus causes many of the cervical cancers. And so a woman should begin having pap tests at age 21, and generally between the ages of 21 to 29, she would go every 3 years. And then starting at age 30, from age 30 to age 65, women should get pap test every 5 years in conjunction with an HPV test, which checks for the human papillomavirus. And then over 65, they should talk to their healthcare providers to determine whether or not they need to be screened. And also, if they've had a hysterectomy, it's important to check with your provider, because it depends on why the hysterectomy was done.
Now, Elizabeth, if someone doesn't have insurance, do you have any advice for them?
The Kentucky Women's Cancer Screening Program is specifically for women who don't have insurance. And so there's a number that you can call, and that number is 1-844-249-0708. And you can be connected to a provider. Again, it may be your local health department, or it may be a clinic that is working with the health department and is doing these services. You would need to fit the screening guidelines, and then you would also need to be at 250% of the federal poverty level, and you shouldn't have any insurance, no Medicaid, no Medicare, no private insurance. And the really important thing for women to remember is, if they are screened through this program, if they qualify for those screenings based on income, then chances are really good that they would qualify also for treatment dollars. So this program includes money for treatment and additional testing to determine, if something is found, they can do additional testing to determine what the next steps are.
All right, Elizabeth, thank you for being with us today. If you are watching and need more information on these screenings, be sure to call 1-844 249-0708.